Hey guys, welcome to another Bald Truth live hair transplant event. Of course, our superstar live hair transplant surgeon, Dr. Alan Bauman, is performing another live neograft surgery, but this time he's doing it on a woman. And we talk about women's hair loss all the time on the Bald Truth, but really the show is focused on guys. Most of the guys that call in, most of the guys that view the program, the guys on the message forums. It's really a guy-dominated, issue for the most part, at least, in the world of the Bald Truth. But I try to, at times, focus on women's hair loss. And, it's something that I talk about as being a neglected epidemic because, 40% of hair loss sufferers are women. In this country and around the world. And, you may not notice that there's so many women out there dealing with hair loss, but the reason is probably they have, I'd say, better prosthetic options, better hair pieces that they can wear. And, very few women are going to walk around with visible thinning hair. But one option that we talk about on the Bald Truth is, surgical hair restoration. Now, I don't personally think it's an option for everyone, but it's definitely an option for the right candidate. So today we're doing a live neograft FUE hair transplant surgery on actually a staff member of Dr. Bauman. Let me say hi to Dr. Bauman and everybody at Bauman Medical. Hey, Doc, how are you?
Hey, Spencer, how's everything going?
Can't complain, man. Can't complain. So tell me what's going on today.
All right, so we're jumping into the middle of our female hair transplant procedure. We're doing a female hairline lowering process for Liz, my director of patient education, who is a veteran of hair transplant procedures because she was born with a very high hairline. And so this is a common request that we have at Bauman Medical Group. One of the indications for hair transplant surgery is being born with a very high hairline. Females with very high hairlines can sometimes be upset about that. They want to lower the hairline, perhaps to make it look more feminine, to make it look more more youthful, and in many cases, we're able to do that appropriately with hair transplant surgery. So Liz has gone through the procedure in the past. She's had actually a linear harvest years ago to recreate the frontal hairline, and then she had a small FUE procedure a couple of years back, and now really we're making some refinements to that hairline, increasing the density so it'll match with her existing hair further back, and to make some changes just to the temporal point and actually the widow's peak as well. So that's what we're up to. We've already done.
Let me ask you, there's a lot of people out there. There's some doctors that say, and I've spoken to doctors about creating a female hairline, and there's a school of thought if there's really not a lot of miniaturization, if there's not this female pattern progression. Some doctors will say that just grafting is not going to match the density behind the grafted area. I've seen some great results from hair transplantation. I've seen some good results, obviously, from more aggressive procedures as well. But I mean, in your practice, when you're doing a female hairline, I mean, is it usually more than one procedure that's necessary to really match that density, or sometimes can you get it in one procedure?
Well, I think it really depends on the patient. How much farther forward are you moving the hairline? Just like in men, if you're moving that hairline much farther forward in a deep hairline recession, then you're at risk for needing more than one procedure. And then there's contrast issues. Is the hair dark and the skin light, or is the hair relatively straight versus curly? So these are all kind of risk factors that I would say would determine whether a patient would need more than one procedure. So a lot of our hairline patients, male patients, need more than one procedure. Guys under the age of 40, I mean.
Well, yeah, but for men, it's a little bit more palatable. If the hairline is not necessarily matching the hair behind it, it could just appear that there's a natural recession of the hairline. For women, I think when they go in and they're expecting to get their hairline lowered, they kind of want it right away. So I think it's all about educating the patient correctly, and so they really understand that, we might be able to get this in one shot, depending on how far we bring it forward, but there's a chance you're going to have to come back in. And at least with women, they have more styling options. I mean, they can kind of comb it forward and, comb it side swept bangs and stuff like that if they have enough hair behind the hairline to cover that area. So, but I just kind of like to prepare women when they're going in to know, and I know that you do as well, Dr. Bauman, that, you may need a couple of passes.
No, that's true. And, I think in any conversation with any patient, male or female, about the hairline, we kind of always have to hedge our bets saying, look, this may need more than one procedure. I mean, look, even an eyebrow may need more than one because it's a very detailed and delicate area. And it needs sometimes some tweaking. I mean, that's just how it is. So 1 or 2 procedures is kind of my regular recommendation for any hairline work that we do,
Right.
Mainly because of those risks, especially if it's a male or female patient with those high risk categories, like I mentioned before, dark straight hair, light colored skin, and so forth.
Now, I'm going to put up a few images of Liz. And first, maybe we should introduce your patient.
Yeah, Liz, how are you feeling? I think you're maybe sleeping. Liz, are you with us?
Sure am.
Oh, she's awake.
Well, we just put
Spencer
up,
wants
we
to
put
know
up some images of Liz
Oh,
so the audience can see.
Yeah, we're gonna. Spencer's showing some images now
Okay.
of your results thus far with the transplantation and the hairline lowering, and some of the comments that we got last night while we were on the air with Spencer was that, wow, it looks pretty good. Well, what do we need to do here? So maybe you can explain, what we're doing here today.
Yeah, so we're just being the perfectionist that I am, and hair is my job. Wanted to add a few more grafts just to densify the hairline just a bit more, and refine a little bit on one of the sides in the temporal area, and bring out the temporal point a little bit more on the other side. We can accomplish that pretty easily. I think we'll use less than 1,000 grafts for sure. So not a big procedure.
Well, let me ask you this. How do you normally wear your hair? Because in the images, obviously, you have your hair pulled back. Do you normally wear it kind of forward or to the side or pulled back? I know that, it's most women don't keep to one hairstyle, so they want to have options. But in general, how do you wear your hair?
In general, I wear it to the side, and with bangs combed over to the side. And that was never an option for me before I had my hairline lowered. So
Right.
I can also switch back to wearing bangs, and then or pulling it back into a ponytail if I'm doing a sport of some kind. So it
Well,
really
let
gives me freedom to move around.
And okay, well, so how has it changed your life as far as, obviously you have more freedom with your hairstyles. I mean, do you have more confidence? Do you feel like, all right, this is something that it was kind of like a long time coming. I needed to do this because I was uncomfortable with, you were uncomfortable with the way that your hair looked or the way that your face was framed. I mean, how long did this bug you for?
Oh yeah, this bothered me for a very, very long time. In my early 20s, I started noticing some temporal recession, and also just the fact that my forehead was so high as compared to other faces, and I just felt like it was more of a masculine look than a feminine look. And so to get my hairline lowered and fill in my temporal areas, it just gave me a much softer appearance and made me feel more confident in my look, especially when the wind blows. And it blows a lot down here in Florida.
Yeah, that's why I can't move down to Florida or to Chicago because
Yeah.
it's just too windy for me. But but you had a traditional harvest before, a strip harvest before, and now you've already had an FUE. You're going for your second FUE. I think a lot of our viewers and our listeners want to know, since you've been through both procedures, what the differences are. We know that with a linear harvest, the grafts can come out great. It has been known as the gold standard for many years, which I think now that the gold standard is evolving into less invasive procedures. Tell me about your experience and the differences you were feeling after the procedures.
Oh yeah, well, even during the procedure, you don't feel any pain at all, but you do feel definitely a tightening once that strip is removed. So the scalp immediately feels tighter, and which isn't uncomfortable, it's just uneasy. And then the healing was quite different. I had to stay out of the gym for 10 days, and even after that, take it a little bit easy so it's not just stretch the scar. And then I slept. Sleeping was a little bit just way more tender in the back. So and again, you had to keep the stitches in the back very, very clean, and that relied on me scrubbing it, and that wasn't too comfortable, but doable.
Right.
And with the FUE, it's a whole different ball game. I was back to the gym in 3 days. There was nothing to clean the donor area, just a little soap and a little rubbing, and then as the little scabs, of course, in the front will fall off normally in about 7 days. And I went back to work the next day, where the linear I didn't. I had quite a bit more swelling, so I didn't feel comfortable walking around with that swelling on my forehead.
Well, and
But
let me ask you this, being a woman, I think it's probably more difficult for you to, I guess it depends on the surface area you're removing grafts from, but to shave down for the FUE. And I don't know, Dr. Bauman, maybe you can answer this question. When you're doing hair transplantation on women now, are they resistant to you shaving, the area? I mean, obviously you explain why it's necessary, but do you think that could be kind of something that stops some women from having FUE?
Well, I think it stops them before they learn exactly what we're doing. So, for example, like in Liz's case, we shaved here just a tiny little zone. It's about a centimeter and a quarter wide. It's about as thick as my thumb. All the way across where the sweet spot is, where she has lots of healthy donor hair, above her previous linear harvest, and she has enough long hair to cover. And in fact, even the male patients that were doing 1,500 grafts or less, as long as they have about an inch of hair, they can cover this area.
See, that would be something that I would do if I decided to get FUE. My concern would be I don't want to shave my head. I've been holding on to this hair for so long.
Right.
And plus I have to be on camera, all the time. I guess I could, you don't really see the back of my head anyway, so I could have all this hair in the front and just have a completely shaven head in the back and no one would notice. But that would look kind of odd in my normal life. But it's good to know that you can do that. And my hair is relatively long. I mean, it's probably about, in the back, it's probably about, 3 inches long, maybe 2.5 inches long, something like that.
I mean, that's pretty long. You will easily be able to cover a linear, easily be able to cover a linear shave for an FUE harvest. A stealth shave would easily be hidden by 2 inches of hair. And honestly, that's what we do for our actors and politicians and people in the public eye, with the understanding that, look, they're not going to get 3,000 grafts. It's not going to be a 2-day procedure. It's going to be a single-day stealth shave. And honestly, that's our typical process for women. So, a woman doesn't have to be worried that she has to do the Britney Spears thing to get a hair transplant. With FUE, right. You don't have to do that.
Well, and I guess a guy can come back or a woman can come back, or I'm talking about myself, after a few months when the hair grows out again, and then you can go into a different area. So yes. I wanted those 3,000 grafts. I can kind of do it like 2 months apart. I mean, hair grows, actually, it would take probably about 4 months for the hair to grow out to a decent length back there.
Yeah, absolutely. And, the truth is that if we're going into a different zone in terms of recipient area, we can come back pretty quickly. I have to just say, I love the way these grafts are coming out, Liz. These are awesome.
Now, can you get a tight shot of the grafts?
Yeah, we can absolutely do that. Dylan's going to adjust the camera here. The grafts are coming out so beautiful. They're like nearly every single one of them is groups of 2s and 3s. They're just, I was marveling before at their quality before we got started here. And they just look great. They look really, really healthy, good groupings of hairs, and they're just coming out like butter.
Now, Doc, we talk about this when we, every time we do a live event, using the NeoGraft to extract follicular units. The talk on the street, everything that, you hear all the rumblings from some of the other professionals and some of your colleagues is that, the NeoGraft can cause issues. Any type of motorized device can cause issues as far as transection. From what you tell me, and your transection rates are extremely low. What do you think? Obviously I know it takes experience to extract the grafts correctly, But I mean, why do you think so many doctors are just saying, hey, listen, these devices just, whether it's a NeoGraft or the Safe System or something else, it's just not as good as a manual punch?
Well, either they haven't tried it or they haven't tried it for long enough. I mean, I don't know what to tell you. I mean, look, you can get around the track in a couple of different kinds of motorcycles, right? And every driver has their preference, or car or whatever. But so every surgeon's going to have his preferred tool. I mean, these are the graphs I just pulled while I was talking to you and while Liz was answering your questions. I don't know if you can see them on this piece of gauze right here, but they're just all lined up. Every single
it
one
kind
of
of
them
it kind of
has.
just looks like it's coming across kind of like a clump of tissue.
Okay, I
So
see. All
maybe
right,
you can separate
let
them.
me spread them out on my finger here. 1 second. I'm going to put them on my finger. See if we can get them. I mean, these are just all right in a row. That's a 2. That's a 3. That's a 2. That's a 3. One of these is a 4. This one's a 4.
And they're just completely intact, and I can see that. I mean, you can never really actually see it unless you look at it, to me, microscopically, but it looks like they are.
I mean, these are beautiful grafts. I mean, they're just phenomenal. Really, really healthy looking. I'm going to put my finger down steady. Try not to move so you can get a close up on it.
No, they look good.
I mean, they're really, really beautiful. I mean, there's not one transected hair, and a lot of that has to do with the technique I'm using. It's a 0.8 millimeter blunt punch. I'm using a two-step technique, so I make the circular incision around the graft first after tumescence, and then I'm plucking them very gently. Really, I never even touch the base of the follicle. I'm only touching the collagen fibers that are right up near the top of the hair, top of where the hair exits the skin. And they just look great. Pass these off
So
tomorrow.
so you're just able to detach them easily once you score that area.
Yeah. So what you missed earlier today is that we actually set the depth of the neograft exactly to Liz's skin. So we do a couple of test grafts initially, and we check the depth. And if the grafts don't, we're only going down maybe maybe 2 millimeters at the most. And remember that the follicle is 5 or even sometimes 6 millimeters deep. And so we start out with a very shallow depth, try to harvest, try to pluck, and if it doesn't just fully release with just a gentle tug, then we go a little bit deeper, just shave a tiny little bit off of that depth guard, and then we go a little deeper. So these are just coming out beautifully. These are just awesome.
Yeah, it's so difficult for me to decipher, the information sometimes because I'm getting it from all different camps. You're using a 0.8 millimeter punch, a blunt punch. Now,
Yep.
initially, from what I understand, wasn't the NeoGraft, weren't you guys using a sharp punch?
Well, it comes with a sharp initially. Yeah, and remember that back 10 years ago, we had the Miltex biopsy punches, which were all sharp. Those were disposable items, manual items that we used. And we started with the sharp, and we went deep with them. And I just realized over time that I got better results, and through collaboration with people in the industry, saying, hey, try the blunt and so forth. I actually designed the Bauman Mindex. Are you feeling that, Liz?
Yeah.
Okay. With the Bauman Mindex, which was the first manual device that was ever literally on the market for surgeons to try to do FUE. When I designed that, they got shipped blunt. And so it was almost like a mistake that they
Right.
came in without a sharp tip on them. The original ones were just prototypes.
You were probably pissed when they first came in.
Well, it was just a design prototype. But then
Right.
we decided to try it. And we had really good success. I mean, they came in different depth sizes because I knew depth size was important. And so then that carried over to the other devices that follow, the semi-automatic devices like the Rotacore that we use, and then the OmniGraft, which was the predecessor to the NeoGraft. And so it's just from trial and error to get the right technique down, and a touch, that you feel, so that you can get the grafts out. I mean, it's just in an intact way. So I think if doctors are saying, well, my grafts are coming out not looking so good, well, then they've got to look at their device and their method and make a change.
Look, it's getting to the point where, and I'm going to backtrack, I discuss this all the time when we do these live surgeries. I have been a huge proponent for FUE from the beginning. And there's just been so many discussions and arguments and differences of opinion from all the main, the really big guys in the field. But I am seeing even the guys that were resistant are now adding FUE practices. And a few of them are becoming very proficient. They're doing more and more. And I think, listen, they're seeing that this is what the consumer wants. This is what, you know, it just to me just looks like the natural evolution of the field. But there could be some drawbacks according to, besides what I was talking about earlier, according to these professionals. And, they talk about surface area scarring, the fact that a linear scar may appear to be, obviously it's more visible, but it may appear to cover more surface area. But in fact, if you're having 3,000 FUEs removed, that, there's more scarring throughout the entire scalp.
Well, that may look that way. It may look that way two-dimensionally, Spencer. But if you consider the amount of defect that a linear scar or linear harvest creates, okay, the amount of tissue that's removed on a standard linear harvest, it's a very thick chunk of tissue.
Right.
And there's no doubt about that. And then if you compare that three-dimensionally with what I'm harvesting out here, and the incision that I've made, which, as I mentioned before, is probably somewhere around 2 millimeters deep with each incision, in the layer of the skin that we're working in, I think the physicians that are starting to work now with FUE are going to realize, because their patients are going to tell them, hey, doc, this feels a lot less painful than what I had before with that big strip removal. So, you can do all the kind of two-dimensional calculations you want, but the proof of the pudding is what the patient feels at the end of the day and at the end of the week. Does that make sense?
It does make sense, and I'm sorry I was distracted by the chat for a second, but it does make sense. And I am, I'm kind of sometimes stuck between a rock and a hard place, because I'm not trying to, step on someone's experience or their, credibility as a physician. I am a layman. I'm here just really to provide the consumer with the best information that's available today. That's it. And sometimes you get torn. There's doctors out there that are, just stating that these just aren't the facts. I spoke to Dr. Bernstein the other day at length, and, he is, he's really involved with FUE. I know that we spoke about this yesterday on the show. And he still considers, and he's told me this, and he's very open about it, and he actually has written about this on his website. He still considers strip harvesting as the gold standard. And it's really funny, actually. I mentioned this on one of my programs, and now everyone on the internet is saying that Kobren says that strip is the gold standard. Because I'm talking about what other doctors have told.
Because you quoted him.
Yeah. Yeah. So now it's Kobren. Kobren says it's a gold standard. What the F is wrong with Kobren? Anyway, so this is probably going to be taken out of context also. But, we talked about the price differential. We talked about, and I spoke about this with Bernstein. I spoke about this with you last night. And in his mind, and I don't necessarily think it's because it's, maybe it is easier, but it's not that he's doing 2 or 3 surgeries a day. And he's a pretty conservative guy. He thinks that in his practice, in the end, the results are better, they're denser, and he has happier patients for the most part with more hair on their head. And he says he's able to achieve that with a strip. And the other guys are saying the same thing. And I just don't know. I can go in and I can watch the surgeries and I can see what's going on. But when you speak to the patients, whether it's a happy patient from a strip procedure or a happy patient from an FUE, they're both happy.
Yeah. I think the same is true. I mean, when we evolved, and I'm talking now, more than 10 years ago, when we evolved from mini grafts to follicular units, exclusively follicular units, went from mini graft, cut to size, to microfollicular dissection, stereoscopic dissection. There was just less hair per graft. So you have to be better at using less grafts. And I was talking about this with, one of my staff members, that you just have to be kind of better at what you're doing when you have less hair per graft to work with, like a follicular unit versus, just putting in a big chunk of tissue that has a lot of hair. What do you think? So the last 50 grafts that I just pulled while we've been chatting, we had 4 ones, 5 2s, and 41 3 to 4s.
Wow. Now, but
So what's that?
that's relatively unusual though for the average patient. Even if you're able to remove those type of grafts, most patients don't have that many threes and fours, right?
Um,
They have
it's not.
threes, but not a lot of fours.
Well, you know what? It's that's it depends on the patient. Absolutely. I mean, look and remember, Liz has already had harvesting back here. She's already had FUE harvesting. She's already had a linear harvest back here. So this is not a virgin donor area. I mean, I tried to go for a sweet spot here where I saw a lot of hair. Um, but if you look at the density even I've harvested, it's not over harvested in any way, shape, or form. There's a lot of hair left behind, and I just went for the hairs that I saw. I mean, that went for what I could see. I mean, those 50 grafts is 3.5 hairs per graft. I mean, that's obviously higher than the standard numbers of hairs in a follicular unit,
Right.
But I mean,
No, that's pretty impressive.
so that's how we judge the quality of what we're getting. And not every patient could do it, and get hairs in that way. But
Let me ask
the
you
point
this.
is that
Let me ask you
it's
something.
in our hands. This seems to work good, and just like we had to make changes to our instrumentation to be able to do FUE and to actually place FUE grafts, those people who are moved from moved from cut to size mini grafts to follicular units had to make changes in their instrumentation as well. It's just not all about how you get the hair; it's how you put it in, right?
Absolutely, and that's something that sadly the vast majority of patients out there, unless they find our resources, are kind of like they're blind to. All they do is they focus on the technology, they focus on the press, they focus on, and there's nothing wrong with that. I think it's important to get the word out there. But sadly, what the press does is it kind of, it soundbites everything, and they don't really give potential consumers a realistic view of the scope and possible pitfalls of these procedures. And what people go in for is, okay, the NeoGraft. It's a sexy device. It's cutting edge. These cosmetic surgeons are now marketing it as the logical endpoint for surgical hair restoration. But sadly, these guys have no experience, and that's the problem. I'm seeing more and more people contacting us who have had NeoGraft procedures, and I'm not saying they're necessarily unhappy, but what I'm seeing is they're not getting the growth that they expected. They're getting growth. They're not scarred, or at least they're not visibly scarred. So it's not like as though they feel disfigured. They just feel disappointed.
Yeah.
And
Well,
I'm sure
there's
that's going to happen with a lot of guys out there.
There's a lot of different pieces of the puzzle. Now, what we're gonna do is we're gonna turn Liz so we can make some recipient sites. I'll try to get some of these grafts. Maybe we'll do a photo of the grafts that I just harvested and tweet that out to those people who are listening and watching. And so we're going to flip Liz over so that we can get her sitting up so I can make some recipient sites for her. Okay? So it'll just take 2 minutes here to get things organized.
So for all you guys who are just tuning in, we are watching a live hair transplant being performed at Bauman Medical in Boca Raton, Florida. Alan Bauman is an accepted IHRS member, and he is an FUE specialist. I mean, this is what he does. This is what he's evolved his practice into, where he's been doing hair transplants for as long as since I've been in the industry, which is 15 years, right, Doc? You've been doing this maybe longer.
15 years of hair transplants.
Yeah, so we kind of got into it around the same time.
1995, I think I saw the first one.
Wow, you were just a kid. I was actually. And one thing that we talk about in this program all the time is, there is a large percentage of hair loss sufferers who are women. What are women's options? Now, a great option for women, honestly, is if they are willing to wear hair. There are ways to wear hair well that is not going to damage your hair. So, I mean, that's a great option for women that, even though men have the same option, it's really not as palatable. I use that word 3 times during the broadcast, to men as it is to women. And also society doesn't really accept it as much. Women can wear hair as fashion, and it's okay. And especially if it looks really good, then it's as acceptable as breast implants or whatever it is. For guys, not so much, sadly. It should be different, but it's not the way that it is. But I think that if a woman is a great candidate for surgical hair restoration, it could be life-changing. And, if you look at Liz and just her willingness to keep having more procedures, obviously she prefers FUE. It's less invasive and she has a faster recovery. But she did great with a traditional strip surgery, and she had really awesome results, which we're looking at right now. And actually, we're looking at Dr. Bauman right now, but I have it on my screen. And you know, she is describing that this is something that gave her more self confidence. And why not? If you can do it, why not do it? But the key is you have to, you really do. And people don't realize this. They're watching this broadcast right now, and they may be contacting Dr. Bauman or, going to the IHRS, and then they're going to try to price it out someplace else, with an inexperienced doctor. Please, really do your due diligence and understand that, yeah, everyone wants to save a couple of bucks, but, you have to do it. You have to do it right. You have to, find the right surgeon who has the most experience in this. And I think it's kind of easier to vet these surgeons than you think. You just have to know how to ask the right questions, right, Doc?
Oh, absolutely, absolutely. The right questions are key, I mean, you wouldn't go to a doctor for cosmetic surgery who just got a liposuction device last month and went to a weekend course. And so, the hair patients need to be savvy like that, and they need to ask their hair doctors, whoever they go to, look, how many of these cases do you do? Do you treat women with hair loss? What percentage of your practice? How many cases do you do per year? What's the amount that you do FUE versus linear strip harvesting? What are the typical numbers of grafts? What are your certifications, affiliations?
This is a problem, though. A lot of times these guys are going in, they're seeing consultants, and the consultant is going to say anything, do anything just to get somebody into the chair. And they'll say, I just remember somebody contacted me, and I actually made the call myself. Somebody contacted me saying that this company was saying that, they're not a part of the IHRS because it's a choice. You could either be part of the ISHRS or the IHRS. And they chose to be part of the ISHRS. So I called this company myself and I questioned them. And you should have heard the bullshit that came out of this guy's mouth. Now, he's the owner of this company and a consultant. And he was basically saying that, they chose to be a member of the ISHRS because it's a much bigger body. And they didn't insult the IHRS, but they almost kind of made it seem like it was second fiddle as far as, where consumers should be looking.
Right.
And I thought that was a very interesting tactic to use. So you never know what people are saying. They're trying to make the sale. It's so hard for a consumer, especially when they're desperate. And if they're comfortable and if it's, if the person is charming, they may be sold a bill of goods.
Yeah. I mean, you got to talk to the doctor. I mean, yes, I have a lot of staff, administrative staff that are, manning the phones and greeting patients and so forth each day, orienting patients to the practice, even just giving information, how to do a virtual consult, what kind of photos I need to see to just get a handle on what your hair loss situation is and so forth. But I think it all comes down to, you get through the consultant, you got to get to the doctor and find out, hey, am I a candidate for this? And how would you handle this situation? I mean, look, I'll give you a great example. There's a plastic surgeon here locally, Dr. Danny Mann, who's a phenomenal plastic surgeon in 30 years plus of experience. And, I would send my family to him in a heartbeat. He's amazing. And a lot of times what he does with his patients is not do a big full facelift, but do these other much less invasive procedures that have phenomenal results, even just simple peels and stuff. So
listen, I'm getting ready, dude. I'm ready for something.
His approach is amazing. But I would trust him with a family member, to that he would be able to direct them as to what kind of process would give them the best results. And I've seen it firsthand. So an amazing doctor, and has all of the different tools in his toolbox.
But
so,
I'm seeing,
women,
and that's awesome. I'm sorry. Go ahead.
I was just going to say, and how that relates to women with hair loss is that a lot of dermatologists, first of all, they don't want to talk to their patients about hair loss. So you're right out the door with a bottle of Rogaine, and that's it. And what we do is we help medically manage our hair loss patients. So men and women, if they have long enough hair, we measure how much hair they've got growing out of the scalp with a scientific device that tells us exactly what the hair mass is. So the hair check enables us to track, if you're on a non-invasive treatment regimen, whether those treatments are working. I don't care if you're standing on your head every night. We'll be able to tell you if that regimen is working for you.
Right.
And if it's not, then obviously we got to take another step. But we medically manage a lot of hair loss patients. Literally, probably close to 500 or 600 patients per year don't ever need a hair transplant.
And look, I'm a prime example of that. Obviously, you're not my physician, but I have been medically managing my own hair loss, by getting prescriptions and seeing doctors for finasteride for almost 20 years.
Well, what's your hair
And
number?
what's my hair number? I don't know what my hair number is. You know what? I don't even know if I want to know, to
Well,
tell you.
yeah. Well, I mean that's a good point, but
Because
you
right
might
now,
if,
I'll deal with the paint and the slight comb over and the hairspray. I'm 47 years old. I feel so fortunate that I started, early. The early intervention is the key, and it really helped me. It definitely changed my life. And I know that you have a lot of patients, like you said, they don't need surgery, and
Sure.
you can manage them for 10 years or more, and they're not continuing to progress. People need to understand that it is possible to
and
stop the
especially
progression of their hair
women
loss.
with thinning hair, that it just, they're not developing a bald spot. They're just developing a loss of volume, a loss of their ponytail volume, a loss of coverage. But way before the coverage goes, they know because they can feel it in their hair. They feel the change that's occurring. And so we can help them figure out why. Is it
I
density?
was like a woman. I was like, I'm telling you, because I had no, at the time, especially at the beginning, no discernible bald spots, even though a hair club wanted to slap a wig on me at the age of 22. But I was just so hyper aware of what was going on, and everyone was saying, you're not losing your hair, you're not losing your hair. But you know what? If I waited, if I didn't get on finasteride when the time was right, I would have been I would have been, just judging from my family, at least a 5, on a Norwood scale, especially at my age, especially since I started at such a young age.
Sure.
So I think it's important. Everyone thinks that, oh, you know what, the doctors are just out there to try to sell surgery. That's where they make their bread and butter. And yeah, I mean, obviously, it's initially it's going to be a bigger hit to sell a surgery, but if you are managing patients for years and helping them, I mean, there's a living in that as well, and you don't have to, the person doesn't have to undergo surgery. So I think that mentality that you see on the internet, that the only reason the surgeons are, part of, they're on the forums and they're answering questions, is simply to sell surgeries. And that's not the case. I mean, these are really the experts in this field, and I think people really need to understand that. Your dermatologist, sadly, is usually not that well-versed in all things hair loss.
I agree with you 100%. So Liz is sitting up. You can get a glimpse here of what our plan of action is, and actually you may be able to hear her a little bit more clearly now with the microphone set the way that it is. But I'll show you the area of main concern for her is to get a little bit more density in this cowlick area. Yeah, thanks for the light there. Cowlick area here, and a little bit off to the left-hand side in the temporal point. And we're going to actually create a little stronger widow's peak right at the center. I don't know if you can make it out yet, but I've already started some of the sites in this location, and I'm going to finish off those sites in the next few minutes. But
Can we zoom into the recipient area?
Do that.
Can we zoom into the recipient area?
Yeah, we're just going to put a head wrap on, so there's going to be some movement there for a minute, and then you'll be able to zoom in and see exactly what I'm doing.
Hey, Liz, how you feeling?
Oh, I'm feeling terrific. It's I've had my nap, and I feel like I'm in great hands here, and I looking forward to watching the paint dry again, which is
Yes.
about how long it takes for the hair to grow in, but it's well worth it. That is for sure.
Yeah, that's the only thing about this form of cosmetic surgery that, again, people who are just starting to do the research, they don't realize that it's going to take, 8 months, 12 months to really see the final result, or even longer. So there is a waiting period. And sometimes, at least with the guys that are getting this done, sometimes it's a what the F did I do period, because they don't see anything happening, and they start to panic and they write us, and they're, and the bottom line is that's something that people really, really need to understand when they're undergoing this type of procedure. Listen, it's not like we were talking about rhinoplasty before, it's not like getting a nose job. Yeah, you're not going to see the final result until all the swelling is down, but you can see a pretty immediate change. And you can kind of visualize what's happening. With hair transplantation, you see it the first couple of days, you kind of see where the hairline is placed. You may see, obviously, the scabs, for a few days. You're like, okay, this is going to look good. And then everything kind of falls out and people flip out. So it's, the waiting period is probably the hardest part.
Yeah, you have to keep what helped me in my previous surgery is just keeping in mind what I looked like those first several weeks, and then I knew that would reoccur in time and very, gradually, and yet I could feel the changes and was excited that even my hair seemed to have more body just as those little baby hairs were growing in. So that way it's all encouraging, and with the oversight of a hair restoration physician who understands those actual time marks to hold your hand, especially because you go through that period just like men do. It's like, oh my gosh, why did I spend that money? Why did I go through that? And at 3 months, you're kind of seeing like nothing. But month 4, it starts to kick in, and you realize. And the staff here at Bauman Medical, we all do a great job of just walking and talking that patient through it, because many of us have been through it ourselves here on staff, and it's all worth it. That's all I can say, Spencer.
Well, I appreciate that. The one thing that I do notice is that, even if women are a little disappointed initially, they kind of react differently than guys do. Sadly, what happens in the male population, especially the real hypercritical guys, the guys that are very hyper focused on their hair and, maybe a little depressed, they all of a sudden go nuts online and start to say things like, I can't believe this is happening. I think I got scammed, stuff like that. When women are disappointed and they come online, they're really just looking for a little reassurance and a little empathy, and maybe just, for someone to hold their hand a little bit and say, okay, look, this is the process. This is what's going on. And actually, I think, I don't know how you feel about it, Doc. I mean, most of your patients are obviously men, but as far as how patients react to, the downtime and certain issues that go along with the surgery. Do you think that women react better in general?
I think, the recovery phase and the regrowth phase is different for every single patient. And I'll tell you why I say that. If it's a guy who has extensive hair loss and we're working into a large bare area, it's only improvement. But remember that if the guy's got some area where there is a lot of hair or a lot of miniaturized hair, sometimes that area will look worse before it looks better. That area will look worse before it looks better, and that's the case also with some women with thin hair. So in those cases, the patient has to be prepared, perhaps for this period of time before the hair regrows, and that can be a psychological issue. That can be a big concern. Now, Spencer, I know you've got some clips there of what we've done up to this point. We showed some of the new graft extractions just a few minutes ago, but obviously Liz had the laser therapy this morning, and then the scalp wash, and of course photos. So I don't know if you want to roll any of that while I begin to work here. It's up to you.
Well, I don't even actually. I don't have the clips here. When did you send them?
We sent them over to you. So I'll double check on that in a moment.
I can definitely. Let's see, Dave Waters.
Yeah, David probably sent those over to you.
You send them to Andrew as well?
I don't have the clips, Spence.
All right, let me forward this to you, Andrew, because you can do it on the fly.
Sure.
Yeah. Anything? Okay, great. Great. No pinching, right?
No pinch.
Okay, great. Phenomenal. Great.
All right, so by the way, let me introduce my sidekick, and also the guy that actually produces these broadcasts and syndicates them out across the internet, Andrew Zarian of the Guys from Queens Network. I know Andrew probably has a couple of questions, and you've been busy kind of making sure everything's running. So, why don't you take it away? No,
I do actually have a few questions. I find it really fascinating on how Dr. Bauman says that it's a little different to do the process for a female than it is for a guy when they're going in to kind of do the hairline. And you brought something interesting up earlier, and I wanted to ask you about this. You said dermatologists stay far, far away from anything that has to do with hair transplants, or even recommended or suggested to any extent. Why is that? Why do you feel that some people are just so terrified of the concept of it that they won't even bring it up to their patients?
Well, a traditional dermatologist who is really looking for lumps and bumps of cancer or something to remove from the skin, not really focused on cosmetic, really has about 4.5 to 6 minutes to spend with the patient, and that's it, before they're on to the next. So I think a lot of it has to do with their time crunch. They may be unable to help, and they also may be unmotivated to help, like they don't think it's a serious concern. Well, I'm not concerned about my hair. Why should I help a patient with their hair? So there's a couple of different issues that go into it. Now, of course, there are dermatologists who are hair transplant surgeons and who are hair aware. So not, it's not a general statement, but many patients come to me after they've been basically, brushed off by their derm.
Do you think that puts a bad taste in their mouths about getting the procedure done when their dermatologist or any other doctor that they went and saw kind of wrote it off as no, I'm not even going to go near there? Do you think it's almost this negative stigma for a guy and a woman about getting a hair transplant?
Well, I think it definitely has a psychological effect. I mean, if you went to your doctor and said, "Hey, listen, I'm having this problem," and your doctor gave you the cold shoulder or didn't think it was important, that could affect you.
I mean, I know people that have gone to their doctors, not necessarily someone that does the hair stuff, but went to their doctor, told them about their hair loss, wanted to get Propecia, and their doctor said, "No, I don't want to give it to you." It's interesting how depending on the doctor, your experience is going to be totally different with whatever you're doing.
Well, that's more common than you think, and it's actually becoming more common now that there's all this press about persistent adverse side effects and sexual side effects from Propecia use. So I think a lot of doctors are kind of now like, all right, I haven't been prescribing much of this to begin with. I don't want to get involved in this. And I think on a personal note, and again, this is just my opinion, I think that's sad. And I think that it is, in my view, doing the patient an injustice. This is an FDA-approved product that we know works. If the patient understands the possible side effects and the possible downside of using this drug, I don't see why he has to, go nuts trying to get a prescription. And what happens a lot of times is once they're turned down initially by their physician or their dermatologist, they end up going online and buying God knows what.
Oh yeah, some counterfeit product from India or something like that.
Yeah, and who knows, how many of these guys who are suffering from these persistent side effects or who think they are. I'm not saying that that there aren't guys out there who are. Who knows if they're all using name brand? Who knows if they're not using generics from India or other parts of the world? And we just don't know. We don't know what the situation is.
Yeah, I mean, have you heard the term mass psychogenic illness?
Yeah, actually, I think we speak about that.
Talk about that? Yeah, I mean, I think that that may be what's going on. I mean, if you're there's some documented evidence that if you're this happened in New York, upstate or something like that. The teacher said in the middle of class, "Oh my God, do you guys smell that? It smells like gasoline." And all of a sudden, 12 out of the 20 people in the class had to go home because they had headaches and burning eyes and so forth. And further investigation showed that there was no gasoline, there was no gas leak or anything in the classroom. That it was just. Yeah.
I'm a firm believer in that. I'm a firm believer in the whole psychosomatic issue with anything. I was definitely, especially as a younger person, a borderline hypochondriac because I grew up around that insanity. And I've kind of evolved and, gotten to the point where I almost avoid seeing doctors now. And that's a whole other story, which is it's not a good thing either. But I can certainly see, I am, part of the world of message forums. And I try not to go on them every day. Honestly, I try not to even go on mine every day because it's just, you read stuff, you could lose your mind. And I tell these young guys, you really have to take things in, with a grain of salt when you're reading it online. Try to look for the real professionals who are providing their advice. But, you just never know where this information is coming from. You never know if it's someone who's selling an herbal product or some sort of a preparation for hair loss. And we see that all the time. And being in the world of the message forums, we can kind of see who's spamming us and, where certain things are coming from. And it's amazing at how many companies out there who are trying to sell their own wares who are really infiltrating the message forums and trying to get that message out there that Propecia is poison. And it's a really big issue. And sadly, the media is even buying into it now in a very big way. Now, I want to say this again to everyone who's truly suffering from persistent adverse side effects. I certainly believe that it's possible. I really do. I don't understand the mechanism of it. I'm not a scientist, and I don't think anyone really understands why this is happening to a small subset of guys. But I do think that there's a tremendous, unwarranted panic out there because honestly, more women who, you're talking about that affect sexuality and, and libido and, just, could give you adverse sexual side effects. Birth control is huge. And you don't see, people trying to ban birth control. I'm not saying that, either way who knows? I don't think birth control is that great for people anyway, for other factors. But there's a lot of women who use birth control for many years. They have a lower libido. They have not much of a sex drive. They have orgasm issues. And then even after they get off the drug, if they've been on for a decade or so, there are people that are complaining of persistent side effects. Many more women that complain about that than men who are getting off Propecia. So I know that was a long rant, but I'm just trying to make a point that, we just don't know. And I think that these doctors are doing their patients a disservice by refusing to prescribe this drug when it could really help them.
Yeah, I agree. Now, obviously, today we're talking mostly about women. So women, it's contraindicated to use Propecia in women. So we're left with one other FDA-approved drug, the minoxidil, and low-level laser therapy, which has achieved an FDA clearance for women with hair loss.
Well, how does that vary from men to women when you're doing non-invasive treatments? How is it different? How is the treatment different? And how is would it be a lower dosage of minoxidil compared to what a guy is taking, or is it the same?
Actually, we use a 5% minoxidil. I prefer the minoxidil 82M, which is a compounded version of minoxidil, mainly because what we've seen over the years is that the over-the-counter minoxidil is pretty nasty. It's just hard for patients to use and hard for patients to be compliant with because it really has a side effect of just making your hair very difficult to manage. And even in those patients where they can manage their hair with the over-the-counter Rogaine, a lot of patients also find they get a lot of skin irritation from it because it's an alcohol base. So over the years, I've tried to search for alternatives to Rogaine, essentially. And I've done this through compounding pharmacists who are willing to work with the minoxidil and just prepare.
I think we lost their audio.
Yeah, we just lost some audio, Dr. Bauman. I don't know if you could hear us. But I don't know if you're going to have to disconnect or if there's a problem with, your board.
I'm not too sure. It seems like something might have gotten pulled or turned off over there.
Well, you know what? You have the videos, right? Why don't we show?
I do.
Run some of that tape and kind of show people what the options are for women dealing with hair loss.
So let me pull up the videos here.
Definitely shouldn't drink tonight before I do a morning broadcast. I'm just tired and bloated.
Here's one of the videos where they are doing the laser light therapy.
Let's see it.
Am I back on there, Spence?
You're back on, Spence. Dr. B.
You're back on, Dr. B. We're going to actually roll some
So
tape.
you're looking at the pre-op stuff that we did for Liz earlier this morning. Before every procedure, we do use low-level laser therapy. We can get back to the minoxidil 82M conversation in a bit if you want.
Sure.
Liz turns this way. Now I'm good. Yeah, that's fine. So low-level laser is a wound healing treatment. That's how I got started with it. And then, of course, we also use it as a standalone hair growth treatment.
How long do they sit under the laser before the procedure?
Before the procedure, it's a 15-minute laser treatment.
And what does it do exactly for people who don't know?
Well, low-level laser therapy increases the metabolism of the cells that you're treating. So, for example, in the skin, we're basically preparing the skin for the trauma of the procedure, almost like recharging your batteries. Ready for the wound healing that's going to occur, ready for what we're going to do in terms of the implantation process. So we're kind of like recharging the batteries up a little bit before we get started with the procedure. And this is a very common practice in wound healing, for example, like the same way you would use hyperbaric oxygen before surgery. Kind of gets everything charged up and ready to go. It does provide a nice benefit before, and then, of course, after the procedure as well, to get you accelerated through the healing phases. So we do the laser light therapy, and then, of course, there's an antiseptic scalp wash, which comes next. And the antiseptic wash is done with the shampoo robot there. Let's see. Yeah, so what are we doing there? Oh, we're doing a hair check there. Okay, so the hair check, we did some measurements for Liz just to see what her hair mass was in some of these different areas. Every patient that we treat, either surgically or non-surgically, does get a hair check. We noticed that Liz had not had one. And so a hair check is nice to be able to see, and that's what I was asking you before, Spencer, if you know your hair number.
I don't want to know. I don't want to know.
Hair
It's actually
check will tell you.
it's giving me anxiety just looking at it.
The hair check will tell you what your current hair mass is. It's a combination measurement of the numbers of hairs and their thickness all together in one simple number. Usually patients come in and they have about between a 70 and 100 in the back of their scalp, and in the thinning zones it can range anywhere from 0 to 80 or 90.
I think this is another gadget that I need to buy, Spence.
Yeah, why are you showing this to him, Doc? He's going to have one in his house now.
Yeah, okay, so now, well, you'd have to come down for us to do it. You can't do it on yourself, actually. And then, of course, this you could. You need one of these shampoo robots in your house, Andrew.
This is definitely something that I need.
That's what he's going to get.
I already bought the densitometer, so I need another hair gadget.
Yeah, absolutely. Well, how about the iPhone microscope?
I haven't used the iPhone microscope. Where can I get it?
Oh man, you know what? I saw a microscope that they had for sale at the Apple Store the other day. But I prefer the hair cam. The hair cam is it's a really, really nice dual polarized lens, which enables you to look a couple of millimeters under the skin. So it's a very cool device.
Is it?
So
where do you find the hair cam? I'm actually interested in that.
Oh well, you can get one from me.
Oh, okay.
Give you a deal on it.
I'm trying to find it. Is there a website for it? Oh, I'm at Bauman's blog. Okay, I'm gonna pull it up here.
I probably don't have too much information on it yet. It's just been on the back burner, but it's based off of another device. So
I want you to explain what you're doing right now to Liz. I know what you're doing, but for those who are just tuning.
So up to this point, we've done some harvesting. We showed some of that before with the FUE neograft process. Now I'm making the sites. So these are the recipient sites where the hairs are going to be implanted. And I've made quite a bit of them already, a couple of hundred already, even just in the past few minutes. In this part, we're going to work on the temporal point. So these are some really small incisions. Just got to keep track of my numbers here so I don't get lost. 1 second. Okay. And this is the temporal point area. And so she wanted to build this out a little bit farther to match the other side, and so I agree. We can make symmetry is always a good thing, so we're going to work to make that happen for her today. So these are the sites. Notice that the angle, the orientation, the position is really, really important as we go through these areas.
Hey, Liz, how do you feel?
Oh, I feel great. I don't feel anything. I just feel some hands on my forehead. I'm wondering when Dr. Bauman's gonna break into the Swedish massage for my neck.
That would be Felipe's job there.
Okay.
I find that to be the most amazing part of it, and I think a lot of people that don't know, what these procedures are like, expect it to be painful to some extent. And everybody that we've ever spoken to or had on the show during the live procedure say they don't feel a thing. They don't even know what's happening.
Yeah. It's one of the first things we talk about with our patients, because whether they bring it up or not, it's in the back of people's minds, and it's really a non-issue. So get that off the table, and let's talk about how we can make them look and feel better about themselves.
Now, Liz, you're involved in the hair world. Was it an easy decision for you to make to do this procedure, or did you have to think about it and say weigh the pros and cons?
Oh no, it was a very easy decision for me to make, because I had helped so many other people make it. So I originally started selling Propecia. I launched that product back in '97. And so I've been talking here for over 15 years, and just really keeping up on the technology and just looking at all the advancements that the field had made. And so I was just it just occurred to me that, hey, we can add hair to what's been lost. We can also add it to a bare area and make my forehead more less embarrassing to me. So why not? And I know the concept of donor, and we have about 100,000 hairs on a head, and so I thought I'd make them do double duty and fill in where I didn't have it genetically.
See, I always wonder that. Is it good to know about the process you're going through, or sometimes is it better to just go in blind and hope for the best, because you kind of get scared and you start thinking about it, you start researching it too much, and I've always wondered what it would be like.
Yeah, I think it depends if you're a technical buyer or just one of those people that say, hey, let me just pull the plug and do it. But I found that in general, those Spencer people, it's much better for the hair restoration, for them people to know, the individual steps and how very simple and controlled and mastered they are, especially here, at this clinic, Bauman Medical. I really feel that the more that they know, the better the patients they are. And then we keep reminding them, throughout, and holding their hand throughout.
And that's important. It's all about really giving the patient a true education, not just the sales pitch that you hear about from some of the larger chain clinics and even some of the smaller independents.
That's right, because I think removing mysteries of the hair transplantation process and further having them understand that it's a team effort, because the patient also has to participate in the prevention of further loss, so they keep that hairline and that hair transplant looking really, really good for years and years and years and years. That's key.
Yeah. Absolutely.
Absolutely, it is key. And one thing that I notice consistently, and again, I talk about the message forums all the time. Even the women that are coming in, they seem to be, I don't know, easily swayed by a lot of nonsense that's being put out there, online. And I always say, and I'm a firm believer in this. Listen, price is important for everybody. It really is. But flying, to have surgery, down in, any type of, plastic surgery or hair restoration surgery down to like Thailand or something. It's just, when there's so many great, or not so many, but when there are great surgeons right in your own backyard, just to save a couple of bucks, these people are doing, and you never know what the outcome is going to be. I mean, it's sad that, I understand that price is an issue for people, but it really should not even come into play when it comes to any type of hair restoration, cosmetic surgery, or plastic surgery. Now, do you notice a lot of people that come into, and women who come into your office, are they concerned about the price, or are they just like, listen, I know this is what it is?
I think we lost some Spence.
Okay.
Yeah, we just lost him. But I mean, it is interesting, and I find it even more fascinating that it's a woman going under the knife, because we hear all the stories from a lot of guys, but we don't hear the female perspective when it comes to hair loss and getting a hair transplant.
No, absolutely. Absolutely. And, a female's perspective is, it seems unique, but it really isn't, because so many women are losing their hair. It's insane. If you go to womenshairlossproject.com and you read the stories of these women, and you're talking about young, beautiful women, some of them are really hot, they go on there and they share their experiences and their advice and their, and it's so much different than the men's area and the men's forum. It's crazy. Women are just so much better at this and so much better at dealing with their emotions. The anger, while they may be angry that this is happening to them, they don't project that anger on everybody that's around them, like you see on the men's forums. But it's just so prevalent. It's such a big deal in our culture, and hair, especially if you look at the way women are portrayed. I mean, it really is all about the hair. It's not so much with guys. Guys, it's great to have a full head of hair, but with women, if you don't have beautiful hair, and God forbid if you have thinning hair or you're balding, I mean, it's devastating.
But
It is.
can you say that it might be a little easier because they could it's kind of more accepted in a way for a woman to be using to have a wig.
It is more accepting for women to have a wig, and there are a lot of wigs out there you can never tell are wigs if if a woman's willing to spend the money or has the money, to do it, and that's going to cost like $7,000 to get a really really awesome, completely natural looking piece. However, they still will feel like they're more in hiding than a man will. Men feel like they're in hiding when they're covering up their hair loss, but once it's found out, the first thing that I think people think when women are dealing with hair loss is that they're sick somehow, or maybe they're dealing with cancer, and they're having chemotherapy, or that's why their hair has that diffuse look, or there's something wrong with them besides, just common genetic, androgenetic alopecia, which is very, very common in women, just like it is in men. Society doesn't get that for some reason. It was never just put out there. There's the education's not out there for whatever reason. Society doesn't understand how many women deal with common hair loss.
I also think, Spencer, that it's changed over the last decade. We see more and more people using hair extensions and filling up their hair and doing, partial wigs, and they're doing all these things to their hair where everybody on TV that you see has this unbelievable head of hair, when in reality that's not true.
Well, that's actually a really good point. You have the hair models, which a lot of women on the sites call hair porn, because it's just these women have such incredible, luxurious hair. And these companies that are selling shampoo, usually these women are very young who are doing this type of hair modeling. But that's not the average head of hair either. But so a lot of women are trying to aspire to that, and they have a lot of additions in their hair. All the housewives, this is what these people do. It's a constant theme that we see on television. I got to tell you, here in Calabasas, in the LA area, but I'm telling you, if I go to Beverly Hills or here in Calabasas, it's insane how much hair these women have. And I can see the extensions and additions from a mile away. And then, frankly, I think that because it's so common, more people are able to see that, but it's just very accepted, kind of like breast implants. The
other aspect of it, Spence, is the fact that so many girls are starting so young. 17, 18, 19, 20, they're using these hair extensions, and by the time they're 28, they're damaging their hair tremendously.
Well, they are damaging their hair, and I was telling a story last night. I saw, I think it was last night. I don't know. I'm all over the place these last couple of weeks. Up in the morning, really early to get coffee and a bagel. This woman came in, young girl actually, with her mom. She had her hair up in a bun, and I saw all the tracks from the hair extensions, and they were basically actually total wefts sewn in to her hair. But it looked like they were placed lower at some point during her life or during the time wearing hair, and a lot of that hair underneath the wefts was completely decimated. Tremendous amount of traction alopecia, and a lot of it may never grow back.
Yeah, it's traction alopecia. It's permanent damage. That's bad news.
And, it's glamorous. It's really, like I said, there's hair salons here in Calabasas, and women just, they're booked up, and that's what they do. They do hair extensions, and same in Beverly Hills, and they're very expensive. Women pay upwards of, who knows, it could be into thousands depending on where you go. And then you see the Kardashians and all these, women around here, and you see them on television. And in my view, they're wearing hair. I'm not going to say that they are for sure, Doc, but this is what women aspire to be. And no one really talks about the damage. And when they do talk about the damage, they're trying to sell you some other crap that's going to damage your hair anyway. But they're saying it's not going to damage your hair.
Yeah, the over-processing and is something that we see a lot of here in South Florida, and the extensions as well. And so, we guide our patients if they are wearing extensions and they will not kind of, get rid of them cold turkey. And we measure, I measure with the hair check in between the extensions, and then, a couple months later, we measure again, and I can tell them, hey, look, this is the damage that it's caused. This is how much hair loss you have had in this area, which is typically not a genetically susceptible area. It's a serious situation. And so sometimes they have to see the measurements to really know what's going on back there. But there are
Well,
many
actually,
who are addicted to the extensions.
well, but I think it's better for a woman to wear, maybe a fall or just a really light, total hair piece that is removable if she wants to have that look. Yes, it does cover their hair, but if it's just for an event or if it's just for nights on the town, that's not a big deal, and they could look incredible. But women don't want that. They want this thing that's a part of them,
Right.
and
Yeah.
it's
We
really
see
too bad.
a lot of it. So it's a big problem. It's a major problem, and I don't think the stylists are equipped to tell. In many cases, the stylists are not equipped to tell their clients what the risks of those particular
Well,
extensions.
it may not be that they're not equipped, and I hate to sound, I mean, yeah, I guess that could be true as well. But I think for the most part, they know, they see their clients that they've been performing this on for years, and they see the damage that's being done. But there's a lot of money in hair extensions, from the markup on the hair itself to the labor, and especially if you're in a high end area like Beverly Hills or somewhere, in Manhattan or in Boca, where, there are people with means that are willing to pay a lot of money to have this process done. And, they're repeat customers. And I think these companies, they do it until these people have, not a lot of hair to tie back, to tie into. And I think it's sad, actually. But there are great options, I think, for women that a lot of women, they think that they are just done if they're losing their hair. And as difficult as it is, there's surgical hair restoration, obviously, for the right candidate. There are good hair additions that are not going to cause permanent damage if they are applied properly. But and there's some great wigs out there. There are women who suffer with alopecia areata or totalis, universalis, and they get on with their lives and understand that there is life after hair loss, as difficult as it is. So when people contact me, especially women, and they think that they're hopeless and their lives are over, I think it's important that they know that there are options out there. So do you guys want to take a phone call?
Oh yeah, absolutely.
Sure.
I forgot that we had the phone lines open.
Let's go. Let's take this call. Hey, you're on the air. Who's this?
I got to ask you, Spencer, is Dr. Bauman in person as handsome as he is on the air?
I think so. I think he's a nice-looking man, Dr. Bauman.
Yes, he is. All seriousness, how is I just woke up. I'm sorry, I apologize calling in late. How is the patient doing?
Liz,
I
how
think
are you
the
doing?
patient's
I'm
great.
doing fantastic.
Joe from Staten Island wants to know.
Oh, the famous Joe from Staten Island. Nice to talk to you finally.
I appreciate that. I know he's that famous.
Yeah, you are.
You're world famous, Joe. Come on, you know that.
I used to only, I'm sure you're in the best hands of a great physician like Dr. Bauman. Are you in any type of pain? Are you sedated?
No, I'm not in any type of pain. I had let's see, about 7 o'clock I had a little Valium, and that was about it. But I have a high degree of confidence in Dr. Bauman and the team, and this isn't my first picnic.
Yeah, she's had a couple of procedures, Joe.
Yes, I understand. We discussed on last night's show, The Bald Truth, 8 p.m. Eastern Standard Time, that Dr. Bauman previously performed about 800 grafts on you. Is that correct, ma'am?
Did you say 800?
I think it was over 1,000.
Yeah, it was over 1,700 over the 2 surgeries.
100.
Yeah, so,
Today.
pardon me?
How many are you having done today?
Today, we estimate about 800 to just put the cherry on top of all the other great work that's been done. As transplanting into bald scalp, it's going to take a little bit to create that the density that this perfectionist would like.
Yes. Now, may I ask you and the doctor, will you be administering minoxidil or some type of topical solution or the laser cap post-surgery, and what will be the time frame on that?
Oh, sure. I've been a proponent of laser cap, using that for over a year now, and 82M, which is our compounded minoxidil. And I will resume that in about 10 days to 2 weeks for the minoxidil and laser cap pretty much in the next couple days. I just don't want to put anything set on my new follicles until they're really taken.
Yeah, she doesn't want to
You
do anything
stated that,
until.
Dr. Bauman, this is for you also, Dr. Bauman, that
Yeah.
you have a special minoxidil. Is it a higher than the normal 5% concentration, which is sold over the counter?
I'll tell you how it's very, very different than the over-the-counter product. So, you're familiar with this solution, which you would get either generically or under the brand name Rogaine, is an alcohol-based 5% without much of anything else except maybe some glycerin, which makes it kind of greasy and gooey. What we have, the 82M contains 5% minoxidil plus retinoin, which is retinoic acid, allows the medication to pass through the skin more quickly. And it also contains a mild anti-inflammatory. So the mild anti-inflammatory decreases the side effects like inflammation at the scalp, so there's less itching and burning and so forth. And there's actually also a little mild anti-androgen in there as well, called oleanic acid, which would kind of, if you were a male, would synergize with potentially with the finasteride. So it's got a lot of interesting ingredients, and it goes on dry, so it goes on very much like a hand sanitizer. So patients find it's much easier to use and absorbs very, very quickly. And based on our hair check results, phenomenal regrowth and improvement in the hair quality. And I have to tell you, most importantly, the compliance way, way up compared to some of the other minoxidils that we've been using. So the 82M is a pretty amazing product, and I'm happy to be able to provide that. But again, just like the NeoGraft, it wasn't the first thing that we used. But it seems to be getting the job done now. We're liking it, and Liz is certainly a user of the 82M, and she can give you all the information about it, how it's affected her.
And Joe, I'm going to cut you off, Joe, but Dr. Bauman wants me to get my hair density checked. He wants to know what my hair number is, and I don't want to do it. I mean, should I get it done?
Personally 2 weeks ago, Spencer.
You what?
Dr. Bauman, I saw Spencer a couple of weeks ago. I can elaborate on it. I studied it, up close.
And that doesn't make me feel too comfortable. You know that, Joe. But go ahead. You can talk about it.
Can I ask the doctor one more quick question on minoxidil to get back to your hair? Doctor, why don't you increase the percentage of minoxidil in your solution? Is there any reason for that? Like 10%?
We've actually tried that. Yeah, we've actually tried that. That was the first thing that we did back in 2006 and 7. We went to a 6% and then eventually to a 7% minoxidil. We can start placing. So 6% and a 7% minoxidil. But the problem was, in order to get that in solution, you have to increase this alcohol concentration as well, and it becomes very, very gooey, very greasy. So a lot of patients did not like the 6 and 7%, and then also it becomes very unstable. So just a small change in the amount of humidity in the air, and that baby will crystallize right up in the bottom. So that's not so good. So the emulsification process is a different way of dissolving the minoxidil. It's not actually dissolved. Think of it like a salad dressing. It's kind of like a mixture of oil and water. So the emulsification is a way to get the minoxidil onto the scalp and also increase that penetration without making it real greasy or gooey. So I'm not a cosmetic chemist, but there's some smart guys out there who figured out how to do this. And the 82M is by far the most compliant treatment that we have topically. I mean, patients are loving it.
What does it cost? What does it cost monthly?
It's about $60 a month, depending on how much you use. Some patients really use a lot of it. We actually measure compliance by how much medication people use over time. And I have to say that the vast majority of patients are at 50% compliance, but that means they're applying it basically once a day or small amounts twice a day than what I recommend. But actually, that's like 4 times the compliance of the 6% and the 7% numbers. So, the data shows, at least in my practice, the patients are a lot more compliant with the 82M. I don't know if it's because it's easier to use or because they're seeing better results or a combination, but it's something like that.
So, in other words, one quick question, it's expensive. If 5% minoxidil hasn't really helped you, this possibly can. That's the bottom line.
Yeah, absolutely. We see a lot of patients, we measure their hair check numbers, the hair numbers with the measurements, and we can see that when they change from 5% Rogaine or 5% solution generic, and they go to the 82M, and they're using it twice a day, that the numbers really bump up. Absolutely.
All right, one more final question. can a patient call you directly and order it, like myself, from your office? Is that a possibility? And just
It is a prescription product, Joe. So you have to actually have a consultation.
Wait a second,
We'll
Joe.
work on the consultation fee for you there. So,
Joe, you're not working for Dr. Bauman now, are you?
Oh, I got you a little extra work, but
Yeah.
Dr. Bauman cured me. How did that sound?
but yeah, I mean, look, if there are follicles up, I mean, we talked about your hair cycling problem last night on the show, and maybe minoxidil 82M would be helpful for you. Keep those hairs in the anagen phase a little bit longer. Get some shrubs turned into trees.
No, but all seriousness, if I called your office, I mean, well, we can discuss Professor off the air. I can't go up to Florida. I'm a disabled person.
Yeah.
But maybe I could just order it over the phone.
Well, you can't really order it. We'll talk about it. You can't really order it over the phone because it's a prescription item. So you got to have a consultation. We can do it through Skype. We'll get your medical history. I got to look at things that you're on. So we do things in a proper and professional way.
Doc, you're not going to give him any medication.
Yeah.
Once you look at his medical
You
history,
got to look at things he's not on, Dr. B.
Yeah.
Yeah,
So
that's the thing. You got to find the thing he's not on, and then maybe.
Yeah. So maybe I need to fly up there and make a house call.
But I tell you the truth, doctor. I literally, my hair has like grown in 25 years. No one believes me. I don't feel no believe me. No one believes me. It has stayed the same way for 25 years.
I told you, man, it's a mystery. I don't know what's going on there.
You better send a picture.
I told you, it's a total mystery. But we'll talk about it. Email me and we'll, so if patients are interested in these kinds of treatments and procedures and so forth, then they just go through BaumanMedical.com and they can initiate the contact there. So, Joe, what you need to do is go on BaumanMedical.com and fill out the consultation form, and that kind of starts the process. And then you can also call. You can call the office.
Well, if I say Joe from Staten Island, maybe I can speak to you personally. I say I'm referring to Spencer in the show. I think you'll know who I am.
Well, whichever way you prefer is fine with me. But, patients can call too. Easy number, 877-BAUMAN-9. Easy to remember. So, then we talk about it, privately over the phone, and we'll see what we can do to help you.
Yes, we don't want to violate any HIPAA laws, right? We don't want any problems with that. I get back to Spencer. Just give me one more minute, please. I've studied his hair up close, and the man has a beautiful head of hair. I mean, I see no balding at all in this guy.
Yeah, well, the whole back is painted, and I'm sure you're examining that.
Sure, to me, I was
Did you see my
examining
before photo on? Nalt sent out a before photo on Twitter.
What was that?
Nalt sent out he tweeted a before photo of me.
Oh, really?
He obviously has been spending a little too much time with the app called the Bald Booth.
Yeah, I actually have some guys. I don't know if you saw Andrew's picture and my picture. A guy was kind enough to Photoshop us with old Jewish guys from Boca hairlines.
Well, I don't know, Dr. B, if you could see the feed, but this is what they did to me.
I'm looking.
It was horrifying. It was like Fu Manchu.
Oh yeah, that's pretty scary.
I mean, yeah, that's pretty scary.
Yeah, they're messing with your mind, man. That's
Halloween.
There's an extremely defeated look on my face in that picture.
But I have to tell you, man, who did that? Joe DeMax? I mean,
Joe
that's
DeMax,
a really great Photoshop, work there. I mean, that's incredible. I mean, it was so. Show him the other ones. You have the other ones?
I don't have the other ones. I gotta find it.
Okay.
So, Spence, we're going to start some placement, so we can show you a little bit of how the placement works. My technicians are getting ready to put some of those grafts into position here.
We'll do that for a few minutes, and then we're going to wrap up today's broadcast.
Amazingly talented technicians, gently working with the grafts that I harvested just a few moments ago, and we're going to get those babies into position. Like I said, we're going to get about 800 grafts today. Into Liz's hairline and temporal point and widow's peak.
All right, well, good. I'm excited to see it, and I know that everyone else is, and it's so interesting to see Liz just sitting there completely relaxed, having a hair transplant. I think that's what people don't understand. They think it's going to be. I mean, listen, it is a surgical procedure, even though it's minimally invasive. You're not using a scalpel. Actually to cut any strip out, and there's no suturing. but it's still, I mean, you're still, having something done to yourself. It is cosmetic surgery. I don't think people realize really how easy it is until they see something like this.
Absolutely right. I mean, we have patients that come in all the time, and if they haven't Googled it on YouTube, to see what we do, then we have to go through the explanation. But I think this brings it right to their cell phones, right to their laptops, enables them to really see exactly what the process is. Really, and here we've shown everything really start to finish, all the different steps and stages, everything from the local anesthetic with the ouchless needle. I don't know, did you guys catch that part? That was right before we went live with you on the Bald Truth, I think. We did the ouchless needle. But
I didn't see that.
Very comfortable. You can ask Liz about it.
Now, did you run all the tape that we have, Andrew?
No, I believe we had one more.
All right, let's see what that is.
The photos and plan, step 3. I'm going to play that right now.
Let's see. So we did our surgical planning earlier in the day. Photos of how her hairline looks right now, and then of course the design based on what Liz wanted to try to accomplish. I try to match the symmetry left and right side. So we've got the plan of action ready to go. She's already had the antiseptic scalp wash at this point. Then we make the markings with the pen, the surgical marker, and off we go, ready to roll.
Liz, I got to say, you are a beautiful woman. You married?
No, I'm not.
All right.
Well, I think Joe is he's married, but I think he's available.
Yeah.
I've heard that story down here in Boca.
Yeah.
I think it's some guy from New York, actually.
Really?
Joe's a former NYPD. He's a New York City cop who was retired.
Uh-huh.
It's a little scary to me, Spence.
And he's how old are you, Joe?
54. How old is Liz? She appears much younger, though.
I don't know if
he's
she's
not
going to
gonna tell
answer
you.
that.
Can I say about 32? Am I close?
Oh, yeah. Perfect.
Right in there.
Right in there.
You see, Joe, you know how to woo him, man.
Well, hey, I was a cop for 20 years. I got the rep, man.
You still got it.
Yeah. Joe, you probably should have started like an hour ago because, you have a captive audience. Not like she can get up and run away.
That's right.
Well, Liz, I know you're tied up, but I want to wish the best of everything. You're a beautiful woman. You're in the hands of a very handsome and fine surgeon. And you have Spencer Kobren on your side. You have Andrew Zarian. And I'm praying for you right now, Liz.
And now you have Joe from Staten Island.
Well, thank you, Joe. We look forward to you Skyping into the office so we can take a look at that noggin of yours.
Well, if Dr.
Solve the
Bauman
mysteries. Solve the hair follicle mysteries.
And let me tell you, if you do Skype in and take off your hat, Dr. B, that image will be worth a lot of money one day. So no one has seen Joe from Staten Island without his hat.
Really?
Really?
Yeah.
That's why, Mayor, I need to make a house call up there, figure out what's going on.
Well, except Dr. Feller, he actually which type of psychotropic medications I was on with his first question.
When you took your
He
hat
said
off
his
because
body dysmorphic disorder he diagnosed me as having.
you still have a lot of hair.
Well, not really, not necessarily. Spencer, by the way, your teeth look very beautiful today.
Oh, thank you. I appreciate that. I pride myself on good dental hygiene.
Well, Liz, if you're comfortable, just email Spencer your home number if you'd like to discuss your post-surgical situation with me. I'll give you my professional advice, even though I'm not a physician, as you know.
I think we're just going to hear silence now, Joe. All right, Joe, listen, and we always appreciate the call. Thank you so much for, I know it's early for you in New York. You usually don't wake up till about noon.
I did that up, actually.
Okay. So thanks for taking the time to get up and call the show.
Okay. One more quick question. Will you be working Andrew Zarian for you on Friday, 8 p.m. Eastern Standard Time?
I will. I'll be there.
All right. God bless you, Liz. God bless you, Dr. Bauman. God bless you, Andrew. God bless you, Spencer.
God bless America, Joe.
You're all great Americans.
All right.
No, you're a great American, Joe.
Well, Dr. Bauman saved my life maybe one day. try to help me one day, and you know,
Look,
maybe I can make you more famous.
I'm sure if Dr. B could help you, he would. He will.
Maybe I can make you more famous. I'm sure if Dr. B could help you, he will. He will. I'm
Is that your computer? All right, Joe,
Yeah,
I got to
that's
pop you down. I'll talk to you later.
No, I'm sorry. No, it was an accident. My wife came in. She said you distract this, and we're trying to corrupt your computer again.
Oh, all right. Well, we'll talk to you later,
Okay,
Joe.
All right,
All right.
Please take care. Maybe you never know. The future holds.
Okay.
It's not a bright future if Joe's in it.
Holy cow. Oh, my God.
Oh boy, oh boy.
So it's only 11 o'clock in the morning here, and this is what we're hearing. Anyway, and Joe sounds medicated already, and he just woke up.
Hey, it starts early.
Yeah, well, listen,
That's a
if
great
you can
looking
do it,
shot.
why
You
not?
guys see those hairs growing in there, that going in, it looks really good.
All right, so let's take a look. Let's put the camera on Dr. B and Liz, and then we're going to have to wrap up this live event.
Yeah,
I want to
what
thank
color?
everybody for
Flies
joining
are
us.
fun.
Go ahead.
Oh no, I like the up close. I like the close up.
Mm-hmm.
Close up was outrageous.
Those little
The little
follicles
baby's
going in.
Yeah, it was really good. You had the right
It looks like your internet kind of crapped out a little bit, Doc.
Okay, hold on. We're checking that.
It's been like that for a
Nobody
while.
moves. No, I'm just teasing. It's all the multimedia guy's fault. I didn't do anything.
Yeah. I think your bandwidth just dropped.
We were so captivated by Joe that we stopped paying attention.
You know, we were so careful with the bandwidth on the last procedure. You know, today we didn't really make any restrictions for the staff, so I'm wondering like how many streams are currently live.
Well, I would say about a half an hour ago, it just completely switched. You'll see it on the tape. But I mean, for the most part, it's been great. I mean, this is really, you know, the quality that you guys are sending us has been unbelievable. Right, Andrew?
Yes.
Now you sound like you're underwater, Andrew. I don't know what's going on.
I don't know what's going on. You know, our website crashed about 3 times from all the traffic that was being sent over. So I guess that's a good thing. And I was trying to get it up, but you know, that's a good problem to have.
Well, our feed alone is ahead of over 4,000 people. So I mean, I'm sure the numbers are going to be great, Doc. And I think a lot of people are just really curious. I mean, we did one female hair transplant. It was a strip procedure with Monica Brandt, and that was crazy. This is really before we had the higher end video equipment, and so the feed was, you know, it was okay. It looked fine for its day, which was like 2 years ago, but it's nothing compared to what we have now. But I remember the amount of people that came to visit, you know, the different sites we were on was pretty impressive. But I think this is going to beat it. I think it's because of your fame, Dr. Bauman.
How's that? What?
I think it's because of your fame.
Oh, well, thanks, man.
Everyone's excited to see Dr. B perform surgery
Yeah,
on somebody.
you're a victim of your own success. You know, that's what happens when you have huge viewership. It'll crash your server there. So
Right.
everything looks and bandwidth-wise, everything looks good on our side. We've got the green light here on speed test and so forth. So you know, it's probably your side.
Yeah, we're gonna blame. I'm gonna blame Andrew.
Listen, I have fiber lines coming into the studio, so it's not me. I think it's Spencer. I think it was Joe. Joe did it.
Joe. It sounds like your audio, at least to me, I'm recording it. It sounds like you are on a rotary phone underwater.
I don't know. That's weird. I don't know.
But anyway, listen, guys. I want to thank everybody for joining us today. I want to thank Liz for allowing us into her, you know, world, you know, into the OR to watch this process. I think it's very brave of anybody to do it. I would never do it in a million years. I don't like anybody even looking at my hair. So, you know, I think that it's great that you're willing to share this so that other women can, you know, be better informed and to empower themselves with the information that we're providing here.
No, and it's great. I mean, the amount of information and the questions and the Twitter feed and everything, all of that helps. And you know, we look forward to continue to answer those questions throughout the rest of you know, while we're here. Certainly, you know, doing the procedure. We're going to stay live on live stream for a little while longer, and then of course, if patients or people have hair loss questions, they can always reach me through the website baumanmedical.com.
Well, listen, I appreciate it, guys, and the staff. Thank you for doing what you do, and to all the video guys, Dave, and what's the other guy's name?
Dave and Dylan, yeah, David Waters and Dylan Yance are the men behind the machines here, providing you with the quality video work, and you can check out them at themultimediaguys.com if you want to host your own live surgery webcast or your own shuttle launch or whatever it might be. They're guns for hire.
Oh, that's very cool, guys. That's actually good to know. Maybe at some point we can get you some gigs.
Yeah,
So, all right, guys. Andrew, any last comments or questions before we wrap things up?
No, it was great. I actually had a lot of fun watching this one.
All right. Well, you can, again, check out Dr. B at baumanmedical.com. He's obviously an accepted IHRS surgeon, so you can see his profile at ihrs.org if you want to ask questions in the message forum. Obviously, go to baldtruthtalk.com. And listen, if you're a woman dealing with hair loss, and we've really been focusing on women, there's a great site out there. It's the Women's Hair Loss Project. That's Women's Hair Loss Project.com, or is it woman? I was womenshairlossproject.com. I'm an idiot, but great site, great support on that site, and just a great place if you're just going through the initial throes of hair loss. There's some really good guidance there. Dr. B, again, thank you so much. Liz, good luck, and we'll talk to everybody soon.
Yeah, we'll post some pictures of her post-op and the healing, and of course the regrowth when the time is right. So we'll talk to you guys soon.
Thanks
Awesome.
a lot,
Take
guys.
care. You got it.